Hi, I'm Hillary Shager. I'm the Associate Director of Programs and Management here at IRP, standing in for Sarah, who is giving a talk elsewhere today. And I'm very excited to welcome Anjum Hajat from the Department of Epidemiology at the University of Washington, a near and dear friend university to IRP. She's here today to talk about precarious employment and its impact on health and health inequity. She's happy to take clarifying questions during the talk, but please save substantive questions for the end, and hopefully we'll have plenty of time for that. And just note that you go till 1:30.
Great.
Thank you.
Yeah, well, thank you for having me. It's really great to be here. I was commenting on, we have a very similar conference room, minus the mountains, of course, but beautiful here. Walking through campus, I hadn't had a chance before, so it's great. So as noted, I'm an associate professor in the epidemiology department in our School of Public Health at UW. And it's a pleasure to be here to share some of with you. I know you all have quite the reputation out there, so I will say our property kind of much smaller. We always are talking about all the great work that you all do here, so it's great to be here. So I'd like to start with land and labor acknowledgement. So where I do my work in Seattle is the home of the traditional land of the Coast Salish people. That's the Duwamish, the Suquamish, the Tulalip, and the Muckleshoot nations. And we pay our respects to the elders, both past and present. And given that my talk is about labor, I also like to do a labor acknowledgement to acknowledge the debts of the enslaved people, primarily of African descent, whose labor and suffering built and grew the economy and infrastructure of the nation, and that it was refused to recognize their humanity. And of course, this continued exploitation of workers it continues to this day. So we'll talk a little bit about that here. So first, I want to start off with the acknowledgement slide. This is several of my collaborators, really great students and postdocs that I've been very fortunate to have over the years, as well as some other faculty members. So this is, I feel like science is a team sport, and so nothing gets done without the team. So I wanted to really start there, as well as funding from the NIH. So I'll start off with just a little background, some motivation about what the sort of state of the labor market, a little bit about precarious employment, what it is, who is most impacted, has it increased over time, a little bit about how it impacts health. And then sort of for the meat of this, we'll talk a little bit about how precarious employment explains growing educational disparities in health. So I will say all the work here is very US focused. I unfortunately don't do any global work, but these ideas around precarity are global, of course, and can be transported to many different contexts. So I think most of you are probably aware the labor market has really changed pretty dramatically over the recent decades. This is including a shift from sort of more secure employment towards this sort of idea of more flexible. You might remember a day back in the 60s and 70s where you could get a job at one of these big companies like Ford or something, and you could stay there for your whole life. And you'd end up with this nice pension, and you could move into the middle class, and it was great. So those jobs are really fewer and far between these days, and so we wanted to sort of understand what the implication there is for population health. And this idea of employment quality and precarious employment that I'll talk about is really sort of multifaceted and required this sort of more rigorous and theoretically driven approach, which is hopefully what we're trying to bring to this work. So as I mentioned, this idea of destandardization of employment. So historically, we have called in this work a standard employment relationship, or an SER relationship, was the gold standard. So these are the jobs I've just described, very permanent, ongoing contracts, regular hours, direct employment, so there's no middleman between you and your employer, and pretty adequate wages and benefits. However, it's very also important to note that these SER jobs were really only available for a subset of people. And that subset, as you can imagine, was primarily white mix, right, at that time. And this is an important caveat, really, that the labor market has been, and still is, continues to be riddled with inequality. So on the graph here on the right-hand side, you're seeing data from the UK, where they're sort of showing increases in precarity over, I guess this is a 20-year period-ish. And I'll share some US data with you momentarily. So there have been, of course, many macro level drivers to this idea of destandardization, or this movement away from SER-like jobs into more precarious jobs. So of course, we've had a series of recessions over time. And in some of these, and some of you might remember this, in the 2008 recession, there was some of these big companies like FedEx, they had switched to temp workers or to contract workers to save money, and then they never really switched back, right? So these are people who sort of became sort of in a role as a contractor when they used to have sort of this much more stable employment. And then, of course, changes in social policy, which I know all of you are probably more familiar with that than I am. So welfare reform, of course, in the 80s, and then job requirements for things like SNAP. I know people are talking about job requirements for Medicaid as well these days. These types of neoliberal labor market policies that really tend to favor the employer at the expense of the worker. I know lots of news around union busting of late. We're having a huge strike actually now in Washington State with Boeing yet again, and the machinists there. But that's sort of a constant, I think, thread these days. As well as globalization has really sort of driven this need to destandardize a little bit, as well as shifts away from manufacturing, technological improvements, and related to that, the digital revolution. So people often think when we talk about precarity that we're talking really exclusively about gig work, but we're not, right? There's actually many different types of precarious workers. And of course, demographic changes in the labor market, right? It looks very different now than it did 40, 50 years ago. So just to give you a sense of what it is when we talk about precarious employment, I will start off by saying there's really no agreed upon definition, right? But in general, people do agree that there are sort of three major dimensions. Employment stability being one of them. So this is this idea of, do you have a contract or not? Terms of employment. So this could be your pay, your benefits, et cetera. And the rights and social protections that you may or may not have at your work. So this is inherently a multidimensional construct. So these features of employment really do co-occur. It's like a package, right? You don't usually see one piece without the other. There may be instances of that, but oftentimes there's this sort of co-occurrence of all. And we can see aspects of precarity really, as I indicated, in sort of any job. So here in higher ed, we do see this actually with this idea of part-time faculty. These are folks that get paid for the class that they teach per class. But they don't have any long-term contracts. They can be, and it's sometimes quarter to quarter or semester to semester, right? There's no real stability in those types of jobs. So we see it in really highly educated folks, as well as on the lower end of the continuum. So the way that we have been defining precarity is sort of through sort of a few more domains that we've added to them. But the bottom line around sort of how I define it, at least, is it's the structural and relational aspects of the employer-worker relationship. And those are determined by here these 7 domains. So many of these domains fit into the larger domains I just showed you. Employment stability is still there. Material rewards, we're just sort of breaking that down. This idea of benefits and pay, as well as working time arrangements you can think about as terms of employment, right? And sometimes these working time arrangements can be quite unstable, where you just don't know your hours from week to week or month to month. And then the last 4 of these, workers' rights, collective organizing, power relations, as well as training and employment opportunities, all fit into this idea of workers' rights and social protections. And I will just note that this workers' rights one in the middle there is really sort of thinking about protections that you may have during non-work periods. So really, this is where we think about all the potential policies that support workers when they are unemployed for a while. And as indicated, these dimensions, come together to sort of form this continuum of employment quality. So when we talk about precarious employment, I often use those terms interchangeably. Precarious employment, sort of this low end of employment quality, and usually characterized by insecure, low wage work, limited fringe benefits, etc. So previous research has looked at many of these sort of domains individually, but I think what we're trying to do here is say, again, this is a package, so it's much more complicated than just looking at, low wage work, for example. We have to sort of think about all of it together. And so that was sort of what we were trying to bring here, is this multidimensionality. And then just to reiterate, it's really a level of precarity and not this sort of presence or absence, right? It's not this dichotomous idea. Okay, so just one other note on this. These are terms that often get, I think, conflated. So work quality is about the work itself. So what type of tasks are you doing? What is the physical environment like at your work? The social environment like at your work? Those things all impact you. So this is really the traditional domain of occupational health, right? Where they would talk about job content and working conditions, hazards on the job, et cetera. We are not usually talking about that when we talk about employment quality or precarious employment. We're talking about the second piece here, the contractual and relational aspects of the worker-employer relationship. But if you take these things together, is this broader idea of job quality, which many people also study. So I'm trying to make a little bit of a conceptual distinction here. And there is some good work, theoretical work, really to support that these are separate constructs. Okay. So this is some work from one of my former postdocs, where we were trying to understand who in the US is most impacted by precarious employment. So here we used data from the HRS, and we were looking to see how precarity was distributed in the population. So as you can imagine, the exposure to precarious employment is not random, and it is sort of those populations that tend to face other forms of oppression that are also more exposed to precarious employment. So thinking about really these intersections of education, race, and gender, which is what we were trying to do here, to sort of but we weren't, unfortunately, we were unable to capture immigration, which is also another big piece. It tends to be, women tend to be more precariously employed, people of color tend to be more precariously employed, as do lower educated workers and immigrants. I don't remember why we didn't include immigrants here, but we did it for some reason. So what you're seeing on these graphs on the left-hand side here, I don't know if this works, but that's right. On the left-hand graph is just overall, and what you're seeing is it's sort of broken out by the panels, the vertical panels are education. So less than high school degree, and a college degree. And within the panels, you're seeing it organized all the same way. It's Latina women, Black women, white women, and then Latina men, Black men, and women. And you can see a very consistent pattern, right? Regardless of education, those who have more precarious employment versus those who have less, right? We sort of can predict that, I think, based on our a priori hypotheses or assumptions that we would make. And then on the other graph here on the right-hand side, what you're seeing is change over time. So this was, we have data from 1992 forward. And you can see there are certain groups that actually do have seen a rise in precarity over time. And this is, as you can see, for women, on the less educated side, of several groups of these, actually all, regardless of education, you see that the people most affected or seeing changes or increases in precarity tend to be women. So when the bar crosses the line in the middle, that's a null association. So we're looking at the things on the left-hand side of the graph. Yeah.
Explain how the EQ score is like constructed or measured.
Sure. So I'm going to get into that in a little bit. As I noted, it's a multidimensional construct. We take various indicators, in this case from the HRS, that sort of fit into those 7 domains I showed you previously. And in this case, we created a PCA, and then we sort of plotted it that way. But I will show you another much more in-depth example here. This is sort of just to give you a sense of sort of what's happening with precarity.
HRS is mostly older folks.
It is. Yeah.
So how is usually discussions of precarity, maybe, and you can defer this if this is really a substantive question, but how should I think about these trends in terms of old people when I think most precarity discussions are about younger workers?
Yeah, well, we've done some work on that, and you actually do see an increase in precarity even in older workers, and you see people staying in the labor market longer because they have to, right? So we can have a fuller conversation about that, I think, momentarily, but one of our goals really too was to triangulate across multiple data sets. So I'm going to share with you data from PSID as well. We've done a little work in ad health as well as NLSY. So, we're seeing very similar patterns regardless of what population, what data set we're using. It's a good question. So this is the data from the NLSY, actually. And here again, we were sort of calculating this precarity score we had 13 different indicators from the survey in all of the 7 domains. This was a 28-year period. I will note that the scale on the x-axis is not huge, but we do see this sort of steady increase in precarity over time, about a 9% increases. And here again, higher scores indicate more precarity. But there is, in fact, and as you would, I guess, assume, heterogeneity within subgroups. So I'll show you a little bit of that as well. So here we're seeing, again, change over time is what we're showing you here. That's what the difference measure is. The average score is just sort of the overall average score for these specific groups, white individuals, Black individuals, Hispanics, et cetera. And then you can see sort of some groups have much larger differences over time than others. We see increasing precarity scores amongst males, amongst those that are higher educated, actually, as well as those with a little slightly higher incomes as well. And so this, we think potentially has something to do with a ceiling effect or a floor effect, right? Where they have much more room to grow in terms of having more precarious scores. That's why it's sort of some of the traditionally sort of marginalized groups would have sort of smaller increases is what we're thinking about here. So definitely seeing, again, increases over time and across a variety of different groups. So just to give you a little bit of background in terms of how we think precarity is impacting health, this was a conceptual model we put together. You can see sort of some of the domains of precarity in the sort of greenish box. And of course, we think that there are multiple mechanisms, not at all mutually exclusive. There's potentially some overlap. But precariously employed individuals also tend to do work that tends to be a little more risky or dangerous, right? So there's potential increased risk for work-related injury that could result in poor health, as well as on the wages side, we see potential material deprivation as another pathway, and then of course psychosocial stress. So stress is a place where we're really hoping to explore further in future work, looking at stress biomarkers in a group of precariously employed women. So that is potentially, hopefully, work. But really, of course, not a linear process at all. That was just sort of the way the diagram sort of depicts it. And we believe sort of there's potentially some feedback loops going on with health behaviors, as well as with the psychosocial stress component. So let me pause for a minute and see any other clarifying questions before I move forward.
I have a question on the NLSY. I mean, I'm thinking, given that that's a cohort study, were the trends kind of adjusted by the age, or does it go counter to what you would expect where precarity would go down with age, or? So
that's a good question. So we did, of course, follow individuals over time, and it was a 20-year period. There was a time adjustment made, so that should sort of handle some of that. And as was sort of raised earlier, it is true that you do tend to sort of, some people do move out of precarity with age, but it doesn't. There's still always some group that's there that is precariously employed, regardless. And then these trends could be sort of smaller, right? Where you're not moving from like this, from one end of the spectrum to the other, which is, I think, something that we were seeing there. Okay. So I think in that sort of backdrop of just sort of talking about what precarity is, I was going to sort of move on here to talk a little bit about how precarious employment creates and maintains health inequity. So this is sort of a conceptual model we put together for a review we recently did, where I think what I've tried to do is sort of show there is, in fact, differential exposure to precarity. Certain groups are more precariously employed than others. And this is a function of sort of social stratification, sort of more broadly. And this potentially could be leading to health inequities. But of course, we also have sort of uneven distribution of resources, which is resulting in some sort of differential susceptibility. So we sort of took this broadly from the Diedrichsen model of health disparities. I don't know if people are familiar with that. That's this idea of differential susceptibility and differential exposure leading to differential outcomes. And by differential susceptibility here, we're thinking about different environments, home environments, workplace environments, neighborhood environments with fewer resources, more environmental hazard. This is where precarious employed people live. So then again, potentially resulting in increased health inequity here. And I will also note that there is sort of power in multiple places in this diagram as with the others. And I failed to mention this earlier, but when we conceptualize precarious employment, we really do think about it as a power imbalance, right, between the worker and the employer. And here you can see too, sort of many aspects of power being displayed, right? So in the uneven distribution of resources, in social stratification, et cetera. So to sort of keeping that in mind, so we were really interested here in exploring this role of precarious employment in the educational disparities that we see in health. So we've seen and known for a long time that higher educated individuals or populations tend to live longer health than those with less education. But the part that was interesting, or that has been interesting over time, is that gap continues to grow. And so why does that happen is sort of one of the underlying questions that we were trying to understand with this particular piece of work. So that gap between higher educated and lower educated individuals, what's explaining that? And so our thought was, well, it's potentially something to do with the labor market, right? And this has been this sort of research showing this gap between higher and lower educated individuals is quite consistent. It's consistent even while you account for compositional and cohort effects. So compositional effects being, more and more people are more highly educated, as well as cohort effects, thinking about sort of this idea of age period cohort and disentangling that. And people have tried to do that in literature and sort of see consistently again that this higher educated group is sort of pulling away, right, from the rest, from the lower educated individuals. And people have put forth, labor market and the non-labor market factors here to explain this finding. So to show you just a little bit of data there. So this, I believe, is mortality data from a sort of relatively recent paper where we're seeing deaths by educational quintile. So higher educated individuals are quintile 4, and lower educated individuals are quintile 1. We have about a 17, 18 year period here. And you can sort of see that the slopes of the lines are changing, right? And that the gap or the disparity between them is increasing, both for men and for women. And this mortality differential by gender is very, very well established. And then similarly, not just physical health or death, this is the prevalence of moderate or severe depressive symptoms. Of course, we know health is very multifaceted, so important to think about multiple aspects of it. So this is looking again over time in the higher educated group at the bottom there in that sort of orange color, and the less educated group in the blue. And again, seeing this sort of increase over time in terms of the gap between them. Okay, so then what we were trying to do here with this work is to evaluate the mediating role of employment quality. So the question is why? Why is that gap persistent in there? And so here it seems clear that it had something to do with potentially with the labor market. And we thought, well, this increase in employment quality that we've been seeing over the decades could be really explaining some of this gap that we see. So we set out to do a mediation analysis where education is the main exposure, employment quality is the mediator, and mortality is the outcome here. And as I indicated, here we are using data from the PSID, which I know many of you probably use and aren't quite familiar with. But to remind you, if you're not, longitudinal study that began in 1968. For this particular analysis, we used respondents only between the ages of 45 and 65. Of course, education is quite fixed by the time you're 45, for most people at least. And the 65 cutoff to sort of avoid the exit towards retirement. And so using waves from the 1999 to 2015 survey. So if you recall, PSID switched from this annual survey to the biannual in around 1999, 1997, I think was that last year. And then we included both the reference person and the partner, which we have employment data on, as well as education data and mortality data. And then we're able to follow up mortality through 2017. And this is an important restriction that I'm going to get back to in a minute, but we restricted to those who were employed for wages. So that means we excluded all the unemployed, those not in the labor force, and those that are self-employed. So the reason we do that is they do not ask you questions about your job if you tell them you are unemployed, right? So there's actually no data to support this idea of employment quality to characterize these individuals. I mean, the self-employed are really sort of a different group altogether. And we're doing some future work to try to better understand that group. But I'll show you sort of some sensitivity that we did, because this comes up again and again. Everybody wants to know what happens when you do try to sort of incorporate somehow the unemployed or those not in the labor force. So as I indicated, exposure in this case, or treatment, depending on how you think about that, is the highest level of education. So this was dichotomized pretty simply as a high school degree or less versus some college or more. And the outcome here is all-cause mortality. So PSAD has a match to the National Death Index. So we think that the mortality data is pretty, is not very misclassified. We have year of death for about 99% of all deaths. And this match sort of began in '79. So that we also helps to use the later data because the mortality data is better later on too. So going back to that question about how we define employment quality. So in the PSID, this is sort of how we did it. We had, so every survey sort of, we're sort of, none of these surveys are designed to think about precarious employment, of course. So we sort of, you take what you can get, right? You use whatever indicators are available that work in a sort of this theoretical framework that we are using. So going back to those dimensions, you can see those in the center column here. There are several indicators around employment stability. There's several around material rewards, and a few around working time arrangements and a collective organization. So you can see them listed here: labor union membership, hours worked, overtime pay, etc., pensions. But one thing to note here too is that we are in fact missing altogether any proxies of this idea of training and employment opportunities. And some people will argue that the interpersonal power relations is not really present here. Some people say, well, union membership could be sort of like a proxy for interpersonal power. I tend to think it doesn't really capture it as well, because there we're really thinking about what type of power do you have at work to make decisions about what you do, when you do it, and how you do it. And maybe to some extent union contracts lay that out, but not necessarily always. So regardless, we took these 9 indicators from the PSID and we ran a PCA, so the principal components analysis here, for those of you unfamiliar. So it's a data reduction technique, which was used to combine multiple correlated measures into sort of a smaller number of uncorrelated principal components that are based on sort of this variance covariance matrix between all the variables. So then we sort of found 3 sort of main components from our PCA, and you can see the variance explained at the bottom. So I think it's about 57% total variance was explained. And then we converted this into a continuous EQ score for, calculating for each respondent and summing sort of all of their different measures from these 3 different principal components, and it was weighted by the amount of the variance that was explained. So I think what's interesting too about this PCA is that it does sort of, it interfaces nicely with the original domains that we were thinking about. So if you look at component 2, so that tends to load a little bit higher on hours worked, unemployment, and labor income. So these can be thought about as employment stability, which was one of the big domains of precarity. In terms of component 3, you can think about that a little bit as like terms of employment, right? That tends to be, are you salaried versus not salaried? Are you overtime pay? Those were the ones that loaded highly there. And component 1 is sort of linked to these ideas around worker empowerment or workers' rights, where we see unionization and benefits loading highly. So it's sort of reassuring to see that the components are sort of matching what we think theoretically should be going on. So provide some reassurances there that it's not totally off the wall. But again, multidimensional construct. So it is difficult to measure, I think, inherently, difficult to operationalize in general, with, as I think is the case with many multidimensional constructs. And we have tried this many ways. People always ask, well, what if you do it this way or this way? We've tried LCAs, we've tried sequence analysis for longitudinal data, we've tried just plain old adding it up, right? No PCA, just summing it, weighted, unweighted. We've tried it all. And I feel like we've tried it all. If you know of new approaches, we're very open to hearing about those. But we really see very consistent and similar findings across, regardless of how we are sort of doing this operationalization piece. Okay, so to get into a little bit about the statistical analysis. So here we did, as I noted, mediation analysis, and we were using marginal structural modeling to handle two sort of big issues that comes up with mediation analysis. One is this idea of exposure-induced mediator outcome confounding, which I will explain momentarily. And the second is this idea of exposure-mediator interaction. So this first idea of exposure, does this show up here? No, that's right. Exposure-mediator interaction is not actually pictured because this is a pseudo DAG, not a technical DAG. Sorry, in epidemiology, we use a lot of these directed acyclic graphs. If you don't know it, that's okay. It's a big public health tool that we use to sort of try to understand and tease out relationships, quite useful for sort of longitudinal analyses. So regardless, the exposure mediator outcome confounder is not necessarily, or the interaction, sorry, is not well pictured here. But you can think about how employment quality could more strongly affect mortality for less educated people than for more educated people, right? There's some interaction going on between the exposure and the mediator, potentially. Because those who are less educated potentially depend more heavily on their jobs for survival. So there's some link there between exposure and mediator. So when you have that type of situation, there is potentially bias introduced into your mediation analysis. So using a tool like a marginal structural model is potentially useful. And getting back to this idea of exposure-induced mediator outcomes, so that's what you're seeing here, this arrow from the exposure education is potentially related to all the things in the box that you see with the outline around it. So things like occupation and industry, marital status is in there. You can think about how education is going to potentially be impacting all those variables, right? So again, when you have a situation with exposure-induced mediator outcome confounding, it's a place where bias potentially can occur, and we need to use these sort of other types of methods. So 3 steps in terms of our statistical analysis. So the heart of the marginal structural model in our case here is the inverse probability weight. So that we had to estimate exposure inverse probability weights to address this idea of the confounding between the exposure and the outcome. So those are all the boxes on the top. Education and mortality have a variety of confounders. We need to control for those. We do that with the exposure inverse probability weight. And then we estimated a mediator inverse probability weight. So that's, again, to address these confounders at the bottom, not just the ones in the boxes, but all of them are confounders of the mediator outcome association. So you create a weight to deal with that as well. And then finally, we actually get to run the model, and we estimate the total effect as well as the control direct effect using the weights that we just calculated in steps 1 and 2, as mortality was our Cox proportional hazard model here. In doing so. So I'll talk through this a little bit more as we go, but that's sort of the broad outline of how we approach this analysis. So the exposure inverse probability weight. So what you do with these, so if people are familiar with propensity scores, very similar approach. So we're using a logistic model here where the outcome is that binary education variable. That's the outcome of the exposure model. And the predictors were all those exposure outcome confounders that I showed you in the previous slide. And it's a pretty simple process to just sort of pull out the predicted probabilities and sort of weight those a little bit. It's a stabilized weight, so you have the exposure also in the numerator. And then we truncate those to sort of get rid of these very extreme values because in general, practice suggests that you want your weights to be around 1 on average. Very similar for the mediator inverse probability weight. Here we used, so the mediator was, remember, employment quality. Employment quality is a continuous variable. So there's a couple different approaches literature suggests. One is quintile binning, which requires some transformation of this continuous variable into categorical variables. So we use sort of 10 deciles of employment quality and fit pairwise logistic regressions with the deciles as the outcomes. And again, the predictors shown on the previous slide were both of the exposure outcome and the mediator outcome. So you include all the potential confounders here. And again, we had to do some truncation just at the very top and bottom to get that mean to be around 1. So these you'll be familiar with if you have done some propensity score weights. You can see here that the light blue color is unadjusted. So prior to applying the weight, and the adjusted is the darker color, the darker blue is after we account for the weight. So you can see that all the confounders are much better balanced after the weight is applied, right? So you're seeing it moving over from the light blue to the dark blue. And these are the exposure, this is the exposure inverse probability weight. And then similarly, here's the mediator weight, more variables here because we have more variables that were, they're both the exposure side and the mediator side, so we have to include them all. And again, improvement in the confounder balance once we apply the weight. So we know it's sort of working as designed, right? So then finally, what we're doing here is estimating the total effect. So this is a hazard ratio. If all versus none of our respondents had an education of a high school degree or less. So again, using a proportional hazard model with year since baseline as the timescale. And then the controlled direct effect. So I think in these mediation approaches, using a marginal structure model, all you can get is the controlled direct effect. There are other indirect effects and things, but you cannot calculate that from this model. But it seemed sort of fine for our purposes. So how you would interpret that really is as a hazard ratio if all versus none of the respondents had an education of a high school degree or less, and our employment quality is held at a given level. Across education groups. So what we decided to do here is select 3 different levels of employment quality at the 20th percentile, 50th, and the 80th percentile, where we're higher percentages, it's better or higher employment quality. And we selected these 3 levels to sort of get a sense of, to explore sort of the options across the continuum of employment quality. And, allows us to sort of see what would happen theoretically, if you could, in fact, you can't, of course, give everybody the same employment quality, but if you could, what would be the impacts on mortality? So again, here we used a Cox model with all the exposure mediator interaction term, and all the weights that get put in the model. But remember, after you've created the weights, none of the covariates have to go into the model because you have the weight that is handling that. Yeah.
Probably needs this, but is employment score, employment quality actually a vector of 3 variables coming out of the principal component analysis?
One more time, sorry.
So it's employment quality actually 1 variable or 3 variables coming out of the.
Yeah, sorry, it's 1 variable. Good clarification. Yes. So we summed the 3 principal components to create 1 continuous employment quality score. Okay, so some descriptive results here. This is by education. I'm realizing this is very small. You probably don't need to read all the details, but we had about 380 deaths, or 6% of the total study population in this 18-year follow-up that we had. And what you can see is, as you would expect, income tends to differ between educational groups. Employment-based health insurance, you see pretty large differences in, as well as things like pensions. And if you are or are not salaried. And then you can see the employment quality score on the bottom, and quite large differences between those with higher and lower education in terms of their employment quality score. And then we did just some descriptives by the EQ score itself. So what you're seeing at the top are the percentiles. So remember, higher score is better. So if you compare across some of these variables, you see very stark differences. So let's take union membership, for example. Very few people are members of a union at the lower end of the employment quality scale, as we would expect. but you know, a relatively larger percent, about a third at the higher end. And you see that with health insurance, you see that with salaries, right? So it's sort of gradient across the employment score as we would predict. So here's sort of our main takeaway of the total effect of education on mortality. So remember, these are hazard ratios. So we see a total effect, the hazard ratio is 1.67, so indicating a greater mortality hazard for those with less education compared to those with more. So as you would expect, people with a lower education tend to have a higher probability of death, right? And then for the controlled direct effect is really where you see the effect of employment quality, right? So here again, we held it at 3 different levels, a better or higher employment quality and then lower one. And you can see this sort of pretty clear gradient here. So when, if you gave everybody in the population very good employment quality at around 80%, you see sort of the line is crossing 1, so it's statistically not a significant effect, but it's also a much smaller magnitude effect, right? 1.15, compared to if you gave everybody in the population a pretty poor employment quality score of around 20%, you see an increased risk there for those individuals. So of course, this is a counterfactual contrast, right? Because we are, again, not possible to change everybody's employment quality score, but it does give us a sense of the role that employment quality is potentially playing in this relationship between education and mortality. So by improving employment quality, we also looked at it proportion eliminated, you could eliminate potentially up to 70% of the inequality in mortality between the two education groups. So that's a relatively high percentage. So do we actually believe that it's that high? Maybe not. There's potentially some bias here, but we do think that it's playing some important role. So here are the survival curves. Those of you who are familiar with these, so what you're seeing here is time on the y-axis and the probability of survival on the, sorry, I said that backwards, on the x-axis. But you're seeing the 2 different educational groups, less than and greater than high school. And again, that same pattern over time. Less education really is associated with higher mortality. And you see that gap really increasing when you set the employment quality to a pretty lower level. So at the 20th percentile, the gap between the 2 groups is much higher than at the higher 80th percentile. So sort of just for showing those results in a similar way, in a different way with the survival curves. So the proportion eliminated here, about 70%, as we noted, of educational inequality in mortality could be eliminated if we were able to improve everybody's employment quality to this sort of 80th percentile. And about 50% of this inequity in mortality could be eliminated if we were sort of trying to hold it at this medium level. So that's sort of the broad, another sort of way to think about these results. So then we did multiple sensitivity analyses because there are, potentially errors, room here for some bias with some of the decisions that we made in the analysis. So the first is this issue of, remember that we had excluded the unemployed, those not in the labor force, and the self-employed individuals. So what we decided to do to try to sort of incorporate them a little bit is to use an inverse probability of selection weight. So these are not treatment weights, but selection weights. And they will help sort of deal with some of this over-adjustment bias that is potentially created, as well as some of the collider bias that's created. And I'll show you a DAG in a minute to depict those. And then in the second sensitivity analysis, we instead took the mediator IPW, and instead of using the binning approach, we used the other approach that's often recommended in the literature, which is using a normal probability density function, which is generated from a linear model. So we wanted to make sure, doesn't matter how you calculate your weight, if you do it one way or the other, do you get similar results? So I'll show you that momentarily. And then in the last sensitivity analysis, we decided not to adjust for division of residence or disability status when we were estimating the exposure inverse probability weight, and I'll explain that momentarily as well. So going back to the first sensitivity analysis, so this is, again, remembering that we restricted only to employed individuals. So the concern here is that by selecting only on employed individuals, which is the box in the middle here, you potentially are creating some sort of over adjustment. And this is because education is, directly going to be causing your selection variable or the employment status variable. And additionally, other variables like that, for example, like underlying health status, may be confounding because, of course, employment status and mortality are potentially confounded by one's health status. If you're too sick to work, you can't do it, right? So some association potentially induced there that we were concerned about. So that's what this idea of a collider stratification bias is, and that's what we're trying to show in this DAG. So even if we try with these weights, these selection weights, to include the unemployed and the self-employed, we do see relatively similar results, right? You do see sort of a little bit of a higher total effect and at the 20th percentile. But this analysis is problematic, right? Because again, those people who are unemployed or not in the labor force do not get a score for employment quality. So this is just, again, trying to incorporate them through this selection weight, right? So I think though we would have anticipated that the total effect, it would be larger here than in the primary analysis. Given that, those who are unemployed and not in the labor force tend to be a little bit less healthy on average than those who are in the labor force. So we were sort of reassured that this exclusion criteria that we made at the beginning wasn't sort of dramatically changing things. Our second sensitivity analysis, again, was just in terms of the way we calculated our mediator inverse probability weight. Here you see very similar results. So again, just a different approach to calculating the weight. And fortunately, it doesn't change things much. And then the last analysis was to not adjust for region and not adjust for disability status. And the reason we decided on those two is potentially they could be in the causal pathway between education and mortality, right? So if you, your education, of course, can influence your decision to move. Less educated people tend to be a little more segregated into higher risk jobs in which they have potentially more injury. So that could result in disability status, right? Which then could result in mortality. So if those variables are on the causal path, we want to avoid adjustment for them. And when we rerun the models without them, we see, again, very similar results to what we saw in our primary. So that was reassuring. Okay, so I know that was a lot, but a couple limitations that we have in our in this study. First, we're forcing this employment quality variable to be at a constant. This is, of course, unrealistic. We'll never have that sort of, again, in reality, right? It's just a counterfactual thought experiment in terms of what would potentially happen if you were able to change people's employment quality. We have also potential misspecification of both the exposure weights and the mediator weights. This is sort of one of those assumptions that is made with this method, that you don't have any misspecification. I think, again, pretty unrealistic, pretty hard to assume that we have no misspecification at all. And then this idea of this potential unmeasured confounding of exposure outcome or mediator outcome associations, which there are surely variables that we did not collect or that we do not have access to in the PSID that are potentially confounding these associations. I mean, I think we do a decent job with what we do have, but there is surely something that we don't. So we are potentially violating that assumption as well. And lastly, the measurement of our employment quality data is really limited by existing data. As I indicated before, we are left to sort of whatever is in the survey, whatever the PSID decides to collect, which was not at all designed for employment quality. So we have some measurement error potentially in that EQ variable as well. So overall, I think what I've tried to show a little bit is that precarious employment really has increased over time and is quite differentially distributed, with higher exposure among women, among those less educated, among immigrants and racialized populations. And we also see from sort of some of the other work that we've done here that precarious employment is substantially mediating these educational inequities in mortality, indicating that it is potentially a useful target for policymakers. So I wanted to spend a minute, I know many of you are sort of much more policy focused than I am, so I'd love to hear your thoughts on this. But what I was trying to do here is think about the different potential policy sort of options that we have when we think about precarious employment. So of course, the US, as many of you know, is the only country that has this idea of at-will employment. I also learned that Montana actually is the only state in the nation that has this probationary period, and after you pass that probationary period, you can only be terminated at good cause. So they're the only state that does not have at-will employment, which I did not know. So there you go. Many policies or much work, we've seen in the policy landscape changes around minimum wage. Seattle is now finally implementing its last push towards the highest level of minimum wage that the law, which we passed back in, I think, 2012, allows. So really boosting up. I think most people are at around $20-ish an hour. Their paid leave, Washington State is another state with paid leave. I don't know if you all have it here. This is paid family medical leave. So, all things that are directly related to ideas of material rewards and benefits, right, as well. Seattle also has a secure scheduling law. This is something directly to deal with these ideas of really unstable scheduling, right? So you have to give workers at least 2 weeks notification of their schedule. And none of this like, oh, we're not super busy, don't come in, right? That's a very common practice for low-wage workers and is not does not allow them to sort of plan very well for the future. So that's what our secure scheduling ordinance was designed to do. I think the overtime pay can be both sort of, I've seen sort of state level ordinances around that as well as company specific policies. In terms of workers' rights, here we are thinking about things, again, remember when you're unemployed, when you're facing periods of non-work, what is there to support you, things like unemployment insurance, disability insurance, as well as sort of all the many active labor market policies out there that help people find employment, job search tools, job training, et cetera. In terms of collective organization, of course, right to work laws, many states have them, but trying to sort of think about ways to allow for more unionization and collective organizing. And then these last two are sort of in a box because they tend to be a little bit less related to policy, but can be a little bit more seen at the firm or corporation level, the employer level, right? Where we really wanted to move towards a situation where interpersonal power relations were flatter, where there wasn't a hierarchy. We could think about things like co-ops, where workers actually own the business, right? That inherently creates a flatter structure. Or having other various policies that could create less hierarchy in the workplace. And then lastly, of course, professional development and training are ways to, at the employer level, to sort of assist workers so they're not really stuck forever in the same sort of type of job. So in terms of future work, we are thinking about employment quality in sort of this diverse group of folks. So as I mentioned before, the self-employed is sort of an interesting group that we've been trying to get a little more involved in. We've done some little bit of work sort of around the edges with the self-employed, but I think there's a lot of room there to think about who are the self-employed and sort of what type of employment quality do they have. Oftentimes, we recently did some qualitative work where we found many self-employed people were self-employed because they were not good fits for the labor market for a variety of reasons, right? The traditional labor market was not working for them. So they sort of moved to this idea of self-employment. These could be previously incarcerated people. It could be people with different sort of care responsibilities. Lots of women in these jobs sometimes, depending on the type of work there. So lots of potential there to think about what does employment quality look like in the self-employed. And of course, there's no employer when you're self-employed, right? So it's this idea of this relational and contractual aspects that sort of doesn't really make as much sense. So there's sort of, I think, different circumstances to think about with the self-employed. Of course, lots of work being done, I think, across the country around the gig economy and what are, I don't know if people follow in California, this sort of ongoing battle of are gig workers contract workers or are they employees of, for example, Lyft or Uber? So we'll see as the legislation continues or to sort of try to work that out as they're working it out too in the courts. But the gig economy is another big place to sort of that we'd like to focus future attention. And then this idea that those individuals who are frequently unemployed, they tend to be unemployed, move into a precariously employed position, unemployed, right? So it becomes a bit of a cycle. So how can we sort of think about them in terms of their employment when they are employed? And then lastly, very little work in the US is ever done on the informal work economy. This, we see a lot more work in Latin America and other places where informal work tends to be maybe more just prevalent, but we definitely have informal work here too, right? But we just don't know much about it. And then I have a couple colleagues really focused on policies that are shaping and driving precarious employment and its impact on health. But love to hear people's thoughts on sort of what other interesting sort of spaces, both on the policy side and on the worker side, people are interested in thinking about. But that's all I have, so I'll stop there.
Is it just the money? What do these models look like if you just use total?
Yeah, we get that question a lot. So, why do this whole multidimensional thing if it's really just about the money? So our sort of the answer there, I think, for me at least, is again, it's a package. It's you don't see low wage work usually without all these other negative pieces attached to them. And I think, the money is, of course, a part of it, but it's not the full story, right? And in terms of sort of where do we intervene, people, will always say, well, if we know what one piece is, we can just fix that one piece, right? But I don't think that's sufficient, right? These are complex problems they require complex solutions. So just increasing the minimum wage is not going to solve the problem of precarious employment. We have to have something that is much more multifaceted than that deals with sort of all the different pieces in its totality. And so one thought on that is, really moving towards stronger unionization, right? Because if unions feasibly deal with all of those buckets that we have, all of those domains of precarity. But I don't think it's just the money. I think there are other pieces as well.
I mean, it's testable though, right? I mean, you could
Yes. Yes.
put models with just
With just, yes. Definitely. And we've done that. And there's obviously an effect of low wage work, but it's not as large as with the rest of it.
So for your mediation analysis, I'm curious why you didn't treat unemployment as an additional category for your mediator. Because you transform your mediator to be a discrete variable anyway, not just add one more category for unemployment.
Yeah, that is, I don't know if we ever talked about that. So that's a good idea. We could have created an unemployed group, right? And then rerun the mediation. So some people would get the employment quality score and some people would just be, yeah, we did not try that. That's a good idea. I think, again, we were trying to incorporate them with those selection weights potentially to see if that made a difference, but.
I think that's actually conceptually equivalent to the approach as tested.
Yeah.
It's like both approaches are basically just balancing covariates with respect to unemployment.
Right. You could do the same with the other covariates. Yeah, definitely.
How do you think about, so one element of precarious employment is instability, right? And people changing jobs. And so I think I saw that you measure employment quality from the first time they show up in the survey. Is that right?
Yeah.
So how do you think about people changing jobs or how employment quality might vary over time?
Yeah, and we've looked at that in a couple different papers in the PSID and the HRS. And what's interesting, and this was sort of one of our original questions, is once you're in precarious employment, how hard is it to move in and out, right, is the question. And it looks like it's pretty hard, is what we're seeing in our data at least. There tend to be groups of precariously employed people that stay in those groups. Some people definitely move out, but it's the majority of them are stuck there, right? It tends to be sticky. And you can think about, this makes sense, right? If you don't have a ton of skills, there's not that many places you can go, right? And we don't do a great job of sort of training your career or whatever, in terms of national programs for that. So we do have 2 papers on that look at sort of this this idea of what happens over time with these precariously employed groups. The one thing we found from that work that I think is really interesting is that the trajectories that show up for women are actually fundamentally different from the trajectories that show up for men. There are more precariously employed groups that you don't even see for men, that you actually see for women, that over time, again, that they tend to be sort of stuck in. So it's really sort of an interesting way to look at the question. Questions?
So I have to apologize. I'm an economist, so I think about causality a bit differently. Have you considered trying like employment training programs as sort of an exogenous variation to quality of employment?
So like an instrumental variable approach. Sort of.
Yeah, exactly. I'm not sure if that would work, but in my mind, if these training programs improve your employment chances and like potentially they could improve the quality of the work.
Yeah, no, definitely they should, right? That makes sense. It's a good idea. I don't know where we get that data, like at least from the surveys that we're using. Okay. I don't believe the PSID has ever, I mean, we're missing altogether that training domain in the PSID, so they don't ask, but we can, that's a good idea too, and we can keep looking to see where you might, have that. I think it might require a little bit of, a little bit of primary data collection.
It's a different paper.
Yeah, it's a different, seems like a different thing, but definitely a good idea to potentially look at.
I was wondering if you could talk about the increase of precarity over time a little bit more. So you had some drivers at the beginning, why you think, but then you also had some, like policy levers at the end. And in my mind, like the policy levers, we've made some, not great, progress on some of those over time. And I'm just kind of wondering how that matches with the idea of jobs getting more and more precarious.
Right, that's a great question. I think again, so, some of these big macro level changes, things around globalization and changes in technology, like, I don't know how the policy could work fast enough to keep up, right? In some ways, right, with that. But I think it's very structural too, right? The labor market is really quite designed to benefit the worker, the employer, right? To increase profits. That's sort of the bottom line here. So we do that always at the cost of the worker. So it feels to me that the policy landscape is going to be perpetually behind, given that structurally, that's the way the system is designed, right? Unless we're going to make huge structural changes, which doesn't seem like that's happening anytime soon. So,
is there any demographic change within the workforce too driving this? Do you think, or
yeah, I mean, so changes demographically in the workforce clearly, right? Compared to the '60s, like women in the workforce is much larger percentages. Minoritized individuals, much larger percentages than they have been. But that relates really a little bit to this occupational segregation literature, which finds that there is tremendous amount of segregation in the labor market, where people tend to be essentially prohibited, or very much, it's very difficult to break into certain sectors or industries for women and for minoritized individuals. And I think, we see that. So, yeah. I think the demographic piece is important.
I had a follow-up to the previous question about using job training. There have been a couple of large randomized trials of job training in the US, like obviously it's too bad Jeff had to step out, but National Support Work. And then if you check his papers from the 90s, there was another large one that's been used quite a bit, in case that's helpful. And another thought for sort of natural experiment, it sounded like, as you mentioned, there are a lot of policies that are relevant, but you had mentioned that kind of pro-union could be like one, big summary measure. So, the onset or, repeal of union busting type, policies, legislation could be difference in differences way to get at
yeah,
this.
Definitely. And I've seen some work on that. A former student of mine did a dissertation on unions, and health effects of unions particularly, but I've definitely seen a few papers that use sort of the right to work and different models to sort of explore, not necessarily employment quality, but explore health outcomes for sure.
So maybe you said this and I missed it, but is this all individual level analysis or is this household?
So on the PSID side, it was remember the PSID terms, the head and the referent person and their, they call it spouse, but now they call it partner. So they used to call it spouse, it's old terms of PSID. So it's not full household, it's 2 individuals in the household. That's all they collect, the employment and the health data, match everybody to those, to the NDI, for example.
So in your data, then if you had 2 people, they would each be an observation.
Yes, but we used a cluster.
Okay. And there's probably some decision making within households.
For sure.
About taking on the precarious job versus maybe a non-precarious job,
Yes.
or the trade-offs that might go into caregiving or other kinds of things
Exactly.
that
Yes.
exist. So, I mean, can you say anything about that? Like, do we see those kinds of patterns?
Yeah. For sure, I think, and we do see a little bit of that, where you can see when you break the data out by gender, that the caretaking roles that women have to take on tend to really prohibit them from moving around in the labor market as freely, potentially as they could. And we do see that in some of the data, but it is true that if you have a partner that has a high employment quality job, you could in fact take a precariously employed employment type position out of choice, right? It's not a force thing. I think in the data that we're seeing so we've done this, looked at just individual sort of single breadwinner type households, you still sort of see similar patterns, right? When you take out this potential for these folks that are doing it by choice. And we have definitely tried that in some of the work as well. So I think it's a good point that's to keep in mind. Yeah.
I think to that point, like I would love to see a comparison between essentially the mobility between women who are caregivers. So obviously primarily children, but that's not the only caregiving responsibility, and those who are not. Because these are women who are otherwise sort of in precarious employment. And I would assume that those who do not have caregiving responsibilities, which is maybe both they are required to take precarious employment or may choose, right? That might be affecting the mobility. And I think that might tease out more results as to like really this picture of like who's in precarious labor, why do they stay there?
Yeah.
Which is really what this, and the health effects of it, which is what this really speaks to.
We're working on that actually right now with the time use survey has great data on caregiving and actually has a decent amount of employment data. So one of my postdocs is working on that exact thing. So we'll let you know what we found.
Question about your education categorization, since there's a lot of work showing that health outcomes are actually worse among some college groups, and if you ran any sensitivity analyses where you grouped some college with lower educated or maybe didn't use a dichotomous variable.
Yeah, we didn't for this specific analysis, but for other work, we have looked at sort of different ways to categorize education. I think here it was, we were concerned a little bit about power and sample size, but yes, I have seen that work that shows, that certain, it's not this perfectly linear association. And I'm trying to remember now what we found, and it's not coming to me immediately, when we are able to tease out the data a little bit more with some health effects. And it's definitely not linear, is what I'm remembering, but I can't remember the details off the top of my head right now, but I can share those papers with you for sure. Thank you.
I have a question. Thank you so much for your great talk. I have 2 questions. So my first question is, early on you mentioned in your presentation that like race, immigration status, education are all correlated with precarious employment. So I was wondering, I know this is a different question, but if you ever looked at whether employment quality could reduce gaps in health by race and status as well. And my other question is related to your policy implications. So I know money does not higher wage cannot solve everything, but I was wondering about your thoughts on whether you think that safety net programs like income support policies could also potentially reduce some of the gaps in health by the level of precarity in employment. So yeah,
Yeah, great questions. On the racial disparity side, that's an interesting one. We have not looked at that. This grant was designed to look at the educational, that was the call that we were responding to. But there's that's definitely a logical next step to think about what employment quality is doing in terms of racial disparities and reducing those gaps. Again, getting back to this idea of occupational segregation, I think that we really have to think about what's happening in the labor market in terms of who is able to have what types of jobs. But I would imagine, similarly to what we see here, that there is some potential benefit to moving into sort of higher employment. Although we do see from a ton of literature that the returns tend to be smaller, right? So higher educated, minoritized individuals don't get the same really great health benefit as higher educated white individuals. And this has been shown in a variety of work over many years. So it's not just the work, it's structural racism and other factors that sort of prevent really large health gains, if you will. Your second question about safety net programs was sort of about, sorry, now I didn't write down.
Yeah, I was just curious if you think that although money is not everything, but by providing cash benefits or income support policy also eventually contribute to alleviating some of the gaps in health.
Yeah, and
precarity.
That's a good question too. And there is some work, right, around specifically folks have been doing work around EITC as one of the big sort of poverty alleviators to see if it improves health. And we do see, I think, some improvements there. And then I'm trying to think, lots of work on the minimum wage. The minimum wage literature in terms of health outcomes tends to be quite mixed. It's not strong in any way. So it's unclear to me if maybe it's the program design, maybe it's something else. But from the literature, from those two that I'm thinking of, it is not like a slam dunk, right? It's not an obvious, yes, this is going to improve everyone's health status. Because again, health is super complicated and related to many other things besides just, it's as you know.
Well, join me in thanking Anjum for her